and talking about the students' needs. And then Cassandra is going to talk about her effort to kind of work with her random moment time study and work with her special ed department in order to kind of prune down her random moment time study roster. And I am going to facilitate and kind of try to fill in any kind of blanks. But what we were kind of thinking is that many school districts call their severe needs programs different names. Some of you have been out in those programs and you actually see the needs of the students, and some of you have not been out into those programs. And so we thought it'd be good to kind of start with an overall understanding of severe needs programs, and so we've asked Julie to come and to talk about that. So thank you, Julie.
You're welcome. We have severe needs programs at a number of our schools. Every middle school, every high school, and about 8 of our elementary schools have what we call significant support needs, or SSN programs. These programs are center-based programs. That is, a student may be bused from their neighborhood to a center-based program because their neighborhood school may not have a program to support the level of need. Typically in our SSN programs, students come to us with a variety of disabilities, physical disabilities, cognitive disabilities, multiple disabilities, and I think pretty well, and some kids with autism may also be in our SSN programs. So it is a wide variety of students that may be served with a wide variety of needs. Some students have more physical needs that are health related than others. We also have programs for students with autism, and in our district they are housed in 3 elementary schools. We call those programs communication social delay. Those programs serve students on the autism spectrum. Typically those students are a little bit higher functioning than the students with autism who might be served through an SSN program. That is, they may have more academic focus in their program than the students in an SSN program. Sometimes the nature of their difficulties in the school might be behavioral, might be their social communication skills might be weak, and so the CSD program supports students that way. By the time those students transition into middle school, the services will change to either resource or SSN services, and they would be served according to those program models. The program models at the schools do vary quite a bit depending on student need. So it isn't fair to say that those programs are self-contained. We don't use that terminology anymore because it's a very rare case where a student would be housed in a separate setting all day long. Most of the students are out in the general ed environment with support through paraprofessionals for a good portion of the day. And the paraprofessionals assist them in a variety of ways, not just with educational support, but also with health-related services that they need in order to access the general education environment. Every school has resource programs. Those programs are for students with mild to moderate needs. I will say that in today's schools, we have a number of students with medical needs who could be served in any of those programs, and some who might not be served in a special ed program. They might be students on a 504 plan who have medical needs as well. So there's quite a variety of ways to service students that aren't always disability obvious. They may be serviced in different ways at different schools. We do have some students who have CNA support, some who have one-on-one nurse, some who have paraprofessionals that are specifically designated for the student with a particular medical need or health-related need. We have some we're kind of reluctant, and I think other districts are as well, to point out paraprofessionals as one-on-one paraprofessionals, because the best practice is that paraprofessionals are assisting a number of students. And so typically in our programs, a paraprofessional might be assisting one student in a quarter, and then the next quarter it might be another adult who's working with that student. So the individual support may change as staff rotate through the program.
So Julie, just a follow-up question. So in that particular situation, you could have a service provider that is working with students with a lot of health needs, and because you rotate the next semester or whatever, they might be working with students who have more academic needs and less health needs.
Correct.
Okay.
Yeah, and so it's really, I think what Cassandra's task is to figure out where, what the services are like at the school, which students are being supported, and which staff support those students at any given time, because it may look different. I think it's probably hard to keep your finger on all of those changes, because we do have kids coming in throughout the year, leaving throughout the year, reassignments of paraprofessionals, and so that staff is, and we do tend to have more turnover among our paraprofessional staff than we do in our licensed teaching staff, for probably obvious reasons. Teaching staff are contracted and paraprofessional staff are classified, and they may leave, and then we have to hire replacements. One thing that we do ask of all our paraprofessionals is that they need to be ready, willing, and able to carry out the duties to support the students in their program. So we make that very clear in our interview and application process.
So Cassandra, do you want to kind of talk about your work of pruning your random moment time study roster and working with your special ed department?
It's a moving target. In all honesty, it's about finding out what is going on in each program. Being a nurse, I'm able to get into those programs because I've worked with them in the past. So I have a general idea of who's doing what when, but then I can also go into the programs and see if there's a significant need or a health-related need that I need to really look at. Because at one point we had resource staff that provided personal care services or health-related services just based on the fact that they didn't qualify per se for a significant support need. Well, that has shifted. So looking at my random moment time study, I've gone and polled staff knowing that they're not providing at least 30% of their time in health-related services. But it means getting out and not just looking at their title. It's actually knowing what they're doing. Even though I'm not in schools full-time, I can still look at a personal care services sheet and look at the staff and compare that with what my staff roster says for special education. And then I can also go out and talk to the staff at the schools and ask them, okay, what are you doing? What kind of services are you providing for student A or student B? So it's kind of looking at the whole picture, not just saying, okay, this is the list that my special ed department has given me of staff. This is our turnover. Okay, yeah, we got to change those out. But during that turnover time, who's doing what? And knowing what they're doing to be able to make a more effective time study. So I keep referring back to that, but when you look at what we do for cost reimbursement with our cost reports, the higher those time study percentages, the higher our reimbursement rate is. And I've had to really take a long, hard look at ours just this year and really make some changes to make it more beneficial for our staff as well as for our cost reports.
Julie, you and I were having a conversation this morning and talking about one of your SSN programs. Can we assume that all children in the SSN program use a wheelchair?
Absolutely not. Their needs are varied. And you may have students that are ambulatory that don't require that assistance for ambulation. You may have students that need assistance with toileting. There's a huge range of both medical needs and cognitive, academic needs within that program. So it's a very difficult target to do just by, or a target to hit just by looking at the who's in that program, who's the makeup of the program. You really are going to need to dig down into knowing the case manager, the service providers, having some kind of network to be able to interact with them on a level that allows you to glean that information. It may be, you might get some information from the IEP, although it probably won't identify, the paraprofessional staff that are currently assigned to the student. I don't think in any case they would put names of paraprofessionals in an IEP. So you would have to dig further.
And I think that relationship piece that Julie's talking about is huge. Being able to go in and talk to the folks that are, I call it down in the dirt, but the reality is the folks that are providing services. Being able to go in and ask them, what do you do, who are you working with? Being able to be comfortable with that, and then being able to work with your special education team, with the director, with the assistant director, even with their secretaries, to find out more information, to be able to it's like this big network, like a big spider web, because you'll have you as that central core, that coordinator who's trying to run that program, and then you have your director, your assistant director, their secretaries, and depending on how your district is set up, like with ours, there's human resources, knowing who to go to talk about, well, you know, when someone has left, or, you know, if you have a new staff member, working with finance to find out, okay, how much of this, you know, for the cost report is a federal revenue versus state revenue versus grant money versus general fund, however you want to look at that, because everybody identifies it differently, and having many different departments coming together as well as working with the school staff. So it's like this great big web of people, and then knowing your students on top of that is huge.
Some of the things we've done to assist in making sure that Cassandra knows who the kids are and who the staff are is we've had her come and speak at our SSN teacher meetings, which are once a month. She's also spoken to our resource staff. It happens that there's a smaller number of children in those programs that have medical needs, but there are some. And so you can't just assume because it's a resource level program or a student in a resource program that there are no medical needs. Yeah, you really do have to look more deeply.
So those students that are in the resource, do you think that they're getting about 30% of their services as health services?
It probably depends on the age of the student. I'm thinking of preschoolers that are transitioning into elementary, kindergarten in particular, where they're half-day kiddos. Those students that still require toileting assistance and maybe some assistance with getting around the facility, that might be 30% for some of those kids. We have some with more significant health needs that would also be in an SSN program. So, you know, at the early ages, it's probably less important which program they're in than where the, you know, how the services are being delivered. As students get older, it might be better or easier to determine which program is the better one. But early on, that's the tough call to make, whether or not they're going to be center-based or not.
So kids that are in high school that are still in an SSN program, they may have more significant health needs and are getting less academic support versus maybe middle school?
Again, I think that's going to vary by individual student.
Okay.
And by individual program too, because programs shift constantly. You can have a significant support needs program that can be one semester, literally, it could be even a quarter, where it's all direct health related, but then you have then you'll have it switch over because of transition to where it's primarily cognitive. That they still have they still require assistance, but it's not the same assistance. So it's constantly really looking at the programs and working with your program facilitators as well as your entire department to make sure you're meeting those needs and to make sure you understand who's doing what, when, where, and how.
Another group to network with are the itinerant staff. They know where the neediest students are, and they could probably give you, lists of names to check in with the case manager. Especially your PTs, likely your OTs.
Your nurses.
Nurses, absolutely.
Nurses know the entire population.
Yeah.
From regular ed through 504s through special ed, they know their entire population. They would be able to tell you health-related needs, as well as your OTs, PTs. Speech language can also sometimes help with that and talking to them and finding out what they're doing with their kids.
So I think the takeaway from your dialogue here is that you really cannot just go by a program name. You just can't go by the title of the employee. You really have to really go out and see the students and the program, and that it changes. Mm-hmm. That just because at the beginning of the year you went out and these were the type of kids that were being served in this particular program at this school, maybe second semester that things changed, that those aren't necessarily the same students and the needs are not necessarily the same.
Right.
So it's really getting out there and observing and seeing and working with your partners and trying to identify.
And I do think it's a difficult job to be a paraprofessional for a student with high physical needs. It can be very physically demanding, and I think that's another reason why we have turnover with those positions. So as Cassandra said, she has eyes in HR to help her keep track of the turnover of staff.
But it's just, and it's getting to know, it's basically the bottom line is getting to know your programs really well and getting to know your staff members and communicating with everyone, not just the special ed in general, because it is special ed, but there's that web of other people you can work with to find out more information that you need to hone in on your students' needs.
And the special ed team at the school may not know about some of the kids on 504s that have medical needs that are served through a different set of resources at your schools. In District 20, those, it's not under the umbrella of special education. And so our folks might not know about who services those students and what those services look like.
And with this program, we really want to stay focused on those kids that have an IEP and the services that are on the IEP that are health related. So other people, there may be other needs, but this program now only focuses on IEP students and who have health needs. So,
but it's also good to know about those 504s because they can convert to an IEP like that. So being aware, it's not the most important piece, but being aware of the health-related 504s is huge.
that those students could become eligible for an IEP.
Quickly.
Well, I want to say thank you to Julie and to Cassandra. Really appreciate you coming and sharing the work that you're doing together to help this program and help people understand how to get to the right staff and get the right people into the random moment time study pool. And part of it is knowing your programs and knowing your resources and your people and connections and working collaboratively together. And I can see where that is happening here, and it's great to see.
I couldn't do it without her. I get all the support I need. It's just awesome.
All right. Thank you.
Thanks.